Do you struggle with pain in your lower back, thighs, groin, or buttocks? Does that pain get worse with prolonged sitting, or prolonged standing, or transitioning from sitting to standing, or going up and down stairs? Well, if so, you may have a problem with your sacroiliac joint, and this is the video for you, because we're about to cover one simple diagnostic test to figure out if the SI joint is involved in your problem, and a 3-step routine for overcoming this type of pain. Let's get into this. Before we get into the specifics, it's important to understand a little bit about the structure that we're working with. The sacroiliac joint, or joints I should say, because there are two of them, are located along the lowest segment of your spine, where the sacrum meets up with the ilium, the large wing-shaped bones of the pelvis. Now, the joint surface itself is quite large, and it's unique in that it's a two-part joint. The upper portion of the joint is synovial. It's surrounded by a capsule, there's fluid inside, and a little bit of motion takes place at that joint. The lower portion of the joint is fibrous. It's connected with dense ligamentous tissue that lend rigidity to that structure. The entire sacroiliac joint, both front and back, is covered with dense ligamentous tissue that strengthens and further reinforces the structure for its main function, which is to bear the weight of the axial skeleton and the upper body and transmit forces from the upper body to the lower limbs. Because a lot of sacroiliac joint problems have an underlying component of instability, whether real or perceived, that's one of the first things that I like to test for. Thankfully, that process is extremely simple and it doesn't require any specialized equipment. All we need to do is find a position or a motion that makes your symptoms worse. We then add extrinsic support and retest that exact same position or motion to see if your symptoms have been reduced or eliminated. So say, for example, that your pain comes on when you go up and down stairs. What we would have you do is go up and down the stairs and make a mental note of how much pain you experience. We would then add extrinsic support in the form of an adjustable canvas strap, or a thick belt works really well for this. And then you're going to retest going up and down the stairs. Now, where you position the belt is extremely important. We are not positioning this around the lower back. We're working on adding stability to the sacroiliac joints. Now, to find where you're going to place your belt, you'll start in a standing position and you'll lift one leg. Mark with your finger the crease where your leg bend occurs, and then that's what you're aiming for. Now, your belt should be about 2 inches thick for the best results. I'm going to be demonstrating here using a thick elastic band that's 2 inches around, and you can see that the lower margin of the band is right at that leg crease. I'm going to lock that in place here. And here's the position from the back so that you can see what you're looking for. And you can feel that squeezing right around your pelvis. And then I would go up and down those stairs a second time and see if the pain that I experienced is less or gone. If you experienced a reduction in symptoms when performing that simple belt test, it's very possible that increasing stability around this central portion of your body could be very helpful for you in overcoming your pain. And in instances like that, there are a couple things that I typically recommend. Number one is to avoid all stretching of the trunk, the lower back, and the hips for a period of at least 3 to 4 weeks. Number two is to pick up and begin using a professional grade sacroiliac joint belt. Now, this belt is specifically designed to be worn comfortably and discreetly for multiple hours during the day, and you see that nice broad contact? That means it covers the entire sacroiliac joint and lends maximum support to the area. So you wear this exactly like I showed for that belt test. From a standing position, lift the leg, mark the crease with your finger, and that is where the lower margin of the belt should sit. So you're going to place the belt on nice and snug, lock it down there using the Velcro, and then you see here it has these little Velcro wing tabs that allow you to really cinch it down and fix that joint in place. Now, you want it very snug but not so tight that it's cutting off circulation. You can see here from the back, it's not a lower back brace, which would sit way up here. It's sitting right across the sacroiliac joint adding compression and holding things in place. Now, the nice thing about this belt is that it has an inner sweat guard, and so you can actually wear it right on your skin underneath your clothing if you don't want it showing, and you should be wearing it during all activities that cause discomfort or increase your pain levels. And you're going to definitely be wearing it during the exercises that I'm about to show you. As good as these belts are and as helpful as they can be for reducing symptoms in people with hypermobility, I would urge you not to view this as a permanent solution, and instead to think of it as a tool for springboarding yourself into a permanent solution. For anybody who tests positive on that belt test, meaning their symptoms decrease with the addition of external support, one of the most important things that they can do is to increase the strength and resting tone of the muscles that surround and cross over the sacroiliac joint, thereby increasing intrinsic stability in the region. But it's also super important for anybody who has an instability issue that they be comfortable and safe the entire time they're performing the exercises. And so what we're going to go through now are 3 exercises that are all performed from a supine position where you're lying on your back and the ground is providing external support to your pelvis. Another thing that I'll often encourage people to do, especially in the initial stages, is to wear their sacroiliac joint belt while performing the exercises. One of the great things about these professional grade belts is that they're comfortable and flexible enough that it's easy to do that. And so exercise number 1 is an elevated clamshell. The only thing that you're going to need for this is an exercise band or a piece of exercise tubing that's tied into a loop. And once you've got that, you'll just go flat on your back. Now you're going to slide that loop around your legs and position it just below your knees, like that. Knees are going to be bent to about 90 degrees, head is resting comfortably, and feet should be positioned about hip width apart. I like to bring the balls of my feet up off the floor so that I'm pressing straight through the heels on this exercise. Now, step number 1 is critical. Watch the pelvis. We're going to dip into a posterior pelvic tilt by activating the glutes. So here you want to imagine like the pelvis is a milk jug and you're pouring milk out the backside. So watch what happens here when I activate the glutes. Tilt. Again, tilt. Glutes are locked in. I have light pressure outward against the band, and then I'm going to draw my belly button in, activate my core muscles while maintaining that glute activation. I'm going to push myself into the elevated position where my torso is in line with the top of my thighs. I like to have people rest their fingers right around their belly button and just lightly tap here as a reminder to keep these muscles active the entire time. And then the clamshell portion of this exercise starts from this elevated position. You're going to push outward against the band, keeping the heels in place, hold for 2 seconds in the outward position, slowly return the knees to hip width apart. Keep tapping, push open, hold for 2, slowly return to the start. Notice that I stay in line from torso to thighs the entire time. Glutes stay active, and then external rotators here in the outer portion of the hip work to separate the band. 2-second hold, back to the start, 10 to 20 repetitions, and you're ready to move on to exercise number 2. The second exercise is a simplified version of a single leg bridge, which helps get the pelvis and sacroiliac joints accustomed to asymmetrical motion. The starting position for this exercise is almost identical to the first exercise, so just go flat down on your back. Knees are going to be bent to about 90 degrees, head is resting comfortably. The main difference here in the setup is that your feet are positioned side by side for this one. Still up on the heels, pelvis is going to drop into that posterior pelvic tilt when you activate your glutes, draw in your core, press up to the starting position where your torso is in line with the top of your thighs, and then from here, you'll concentrate on pushing as hard as you comfortably can your left heel down into the floor. And you're going to use that downward pressure on this side to help elevate the opposite leg off the floor. Just a few inches, hold for 2 seconds, set it down to a resting position. Rest for a couple seconds, go into your posterior pelvic tilt, activate the core, push up. Then you'll concentrate on pushing the opposite side, in this case the right, down into the floor. Use that downward pressure to almost push the opposite side into the air. Hold for 2, down, and rest. What's really important here is the downward pressure on the side that you're using for support needs to be sufficient to keep the pelvis level. So press hard on the left, pelvis stays level. If the pelvis collapses, you've lost the whole point of the exercise. Press down hard into the floor. Lots of glute activation here. Set it down and rest. Rest as long as you need in order to be able to perform the exercise properly. Pushing up, pushing hard into the right. Use that downward pressure to elevate the opposite side. Pelvis stays level. Set it down and rest. This is a very challenging exercise. Elevate the foot only as far as you comfortably can, and then stay elevated only as long as you can maintain proper form. Rest as long as you need between. Ideally, you'll get about 5 to 10 repetitions on each side, and then you'll finish with exercise number 3. The final exercise is the easiest of the bunch. It's a ball squeeze bridge combo that's fantastic for activating the hip, pelvis, and core stabilizers all at the same time. What a great way to round off this routine. The only thing that you're going to need for this is a medium-sized ball. A soccer ball, volleyball, basketball, those all work great for this. If you don't have one of those lying around, a firm pillow works really well. So once you've got that, just go flat on your back. Starting position, pretty much the same as the other exercises. Knees are bent to 90. Up on the heels, ball is going to be positioned in between your knees, head is resting comfortably. I like the hands on the belly button. From there, posterior pelvic tilt, activate the core, push up to your starting position while squeezing that soccer ball, hold for 2 seconds, slowly lower down. Just before your rear end flattens out against the floor, come back up. Hold for 2, slowly lower, maintaining the squeeze on the soccer ball the entire time. You want to feel symmetrical motion on both sides as you're going through this. So if you feel your hip dip sharply to one side, focus on keeping symmetrical squeeze on that ball as you're lowering. You want to feel the left side and the right side perfectly synced with one another. 15 to 20 repetitions and you're all done. If you enjoyed this short routine and you want to see what the next level of sacroiliac joint stabilization exercises looks like, leave me a comment down below. Once we get to 75 comments where people are requesting it, I'll make a level 2 video for you all. And if you want to know what brand of SI joint belt I use and recommend, click the link in the upper right-hand corner of your screen. I'll also put a link for it down in the description. Don't forget to hit that thumbs up button before you head out of here, and I'll see you next time.